Hi, good day. This will be your discussion on visual disturbances. This is the beginning of Unit 4 in Medical Surgical Nursing 2. So let's talk about your anatomy and physiology for us to be oriented on this topic. So the basic concepts. Vision is labeled as the most important sense among the five senses. It is considered to be done by your eyes, of course, which is considered as a sensitive and specialized organs. Now, aging is related to our visual processes. So when I talk about aging is usually related to visual or connected to visual impairment. Why is that so? Because in the process of aging, one, there is decreased flexibility and elasticity of the lens. This decreased flexibility and elasticity of our lens would lead to decrease or loss of accommodation. And the term associated to decrease or loss of accommodation is what we refer to as your presbyopia. So oftentimes we hear the term presbyopia. These are visual impairment related to age. Added to that, there is also yellowing. Okay, there is also yellowing of the lens related to age. And this is usually resulting to difficulty in distinguishing colors in the blue end of the spectrum. So that would mean that your patients would have difficulty to see purple, for example. Next, there will be senile meiosis. So in senile meiosis, you can see that there is smaller pupils. Okay, meiosis. When I say meiosis, so remember we have the term mydriasis and meiosis. Mydriasis would refer to pupillary dilation, whereas your meiosis would refer to pupillary constriction. So part of the age-related change is that the pupils become smaller. So this leads to diminished ability to adapt to dim light and darkness. Okay, why? Remember, your pupils would act as an opening. Supposedly, if there is too much light or too much darkness, it will be your pupil which will adjust in size in order to accommodate the need for light. So since there is meiosis, there is constriction of your pupils, it would diminish the ability to dim light and to adapt to dimmed light and darkness. Added to that, there is presence of glare, okay, in aging. So this presence of glare would mask and reduce the brightness of object in the visual field. Further, there is decreased lens transparency, which would lead to increased opaqueness. Okay, the lens becomes more opaque due to deposits of some substances. This leads to a problem that we refer to as cataract. Also, with the aging process, you would notice that there is decreased production of tears, from your lacrimal gland. Okay, with that, it leads to dryness. Added to that, there is irregular curvature, okay, of your lens. And this irregular curvature of your lens would result to distorted and blurred images. The distorted and blurred images would result to astigmatism. So all of these changes combined, we will know that about 2/3 of the population with impaired vision is older than 65 years old. So we can say that age is directly proportional to that of your visual impairment. Okay, whereas for the younger people, the risk for eye disorders is usually related to traumatic injuries. Okay, it's not on the internal structural changes that occurs with age, it's not on the circulatory problems, but oftentimes they are related to traumatic injuries. Now, eyes. So your eyes would encode the pattern of light from the environment, and this encoding is referred to as your photoreceptors. Okay, it will be your photoreceptors that would aid in carrying the coded information from your eyes to the brain. So the signal would travel from our eyes through the optic nerve, which is your cranial nerve number 2, going towards your brain. So recall that your optic nerve number 2 is considered to be purely sensory. Then, added to that, 70% of all sensory receptors can be found on the eyes. And then there are millions of nerve fibers present in our eyes just for our eyes to accommodate our visual needs. Then, okay, so for us to understand the anatomy and physiology, let's review some. So eyeball. Your eyeball is considered to be a round ball-shaped organ. It's about 2.5 centimeters long and 2.3 centimeters in diameter. It is located in the front of the eye orbit. Okay, so when I say orbit, that is where, okay, your bony socket of the skull is, and then the orbit is the one that surrounds and protects the eye. Okay, so orbit is the one where our eye is inserted to. Okay, so orbit is a part of your skull. So let us see the bones of your orbit. if you would look at the orbit, class, this is your orbit and this is the location of your orbit. On the medial aspect of the orbit, you will see the lacrimal bone. Okay, this is your lacrimal bone. On the posterior aspect, you would see your ethmoid bone. Okay, posterior aspect, you would see your ethmoid bone. Okay, here, a little posterior. And then on the lateral aspect, you would see your sphenoid bone. Okay, so this is your sphenoid. On the superior aspect, you will see the frontal bone. Okay, so this is your frontal bone. On the inferior aspect, you would see the zygomatic and maxillary bones. Okay, so posterior to that, you have your zygomatic here, and then you have your maxilla here. Now, your eye is not in direct contact with the bone because that is protected, or your eye is usually surrounded by fatty tissues. When we are assessing the eye, we are paying attention on the internal and external structures. But since we've talked about eyeball, so let's talk about the layers of your eyeball. So there are three prominent layers. Oftentimes, the external layer is referred to as your sclera, your middle layer is referred to as your uvea, and then your innermost layer is referred to as your retina. Each of these layers would have significant and different function. So sclera, your sclera is considered to be an outer layer. It is considered to be the tough layer, which would appear white, okay, and covered by your cornea, and your cornea is transparent. Whereas your middle layer is where the choroid is. Okay, that's why it's referred to as your choroid also, or your uvea. So your choroid is a middle vascular layer. Okay, so another name for your choroid is your uvea. It would include ciliary body and even your iris. And then at the center of your iris is what we refer to as your pupil. So they call that pupil is the center of the iris. Pupil is the one that would regulate the light entry in and out of the eye through the pupil. Then you have your retina. Your retina is considered to be the inner sensory portion, which would be composed of your photoreceptors. There are two kinds of photoreceptors. So you have your rods and then your cones. Okay, let's talk about them on the next slide. So again, class, you need to recall that the external layer is where your sclera and cornea would belong. The middle layer is where your choroid, your ciliary body, and your iris would belong. And then your retina is considered to be the innermost layer. Now, so I mentioned that in the retina, it is where you can see your rods and your cones. So class, your rods would work at low light levels and provide peripheral vision. So you need to remember low light and then peripheral vision. It's either working on low light levels or dim light. Damage to your rods would lead to night blindness. Okay, so we also need to remember that the rods would contain the protein that we refer to as your rhodopsin. Then you have your cones. Your cones are active with bright light levels and provide color and central vision. Okay, so again, color and central vision. In other words, if my patient would have problems with color blindness, it is the cones of the eye which are damaged. That's why oftentimes we are giving vitamin A to our patient with color blindness, although it is not really proven yet, okay, that it would offer benefit. But the principle there is that your vitamin A is needed by your rhodopsin. And then your rhodopsin would aid also on the production of your rods and cones. Okay? Now, cones are very active again. Are very active with bright light levels and provide color and central vision. And damage to the area can severely reduce your central vision. Okay, so take note of that. Again, for the rods to be dim light, peripheral vision, and then damage would lead to night blindness. Whereas for your cones, it will be your bright lights, there will be color and central vision, and then damage would also lead to reduced central vision. Next, you have the refractive structures and media. So this would talk about your cornea, your aqueous humor, your lens, and your vitreous humor. Okay, so later on, we'll talk about aqueous and your vitreous humor. Allow me to focus your attention first on lens. Your lens is considered to be a transparent biconvex structure. Again, it's biconvex, located directly behind your iris and pupil. One of its function is to refract light rays to focus them on the retina. It is responsible for accommodation, which is the change of focus from distant objects to near objects. Which means that if there is any damage on the lens, okay, your patient will not be able to see if a far object is approaching near him, okay, because the problem is already on the lens. Next, we have your canal of Schlemm. So your canal of Schlemm will be the drainage system for the fluid moving between the anterior and the posterior chambers. Yes, our eyes is composed of two chambers. You have your anterior and posterior chambers. And these chambers are filled with fluid. So the fluid is going in and out, okay, or perhaps going out of the eyes through what you refer to as your canal of Schlemm. Okay, so you have your canal of Schlemm. Okay, for the external structures, look at this. So you have your eyelids, your conjunctiva, and then your lacrimal apparatus, okay, which would be composed of your lacrimal gland, your puncta, your lacrimal duct, and then your sac, and then you have your nasolacrimal duct. Now, eyelids. Your eyelids has a purpose, okay, other than you might be thinking of aesthetics. It would brush the particles out of the eye and cover the eye. Okay, eyelashes. Your eyelashes is intended to trap particles and keep them out of the eye. So the purpose would be on protection. And then within those eyelashes of yours, you have what you refer to as your ciliary gland. The purpose of your ciliary gland, okay, so they are found between your eyelashes. They are the ones which secrete acidic sweat to kill the bacteria. On the other hand, your meibomian gland would secrete oily substances, and the purpose of these oily substances is to protect your eyes. Okay, so lacrimal apparatus. If you would look at the lacrimal gland, the puncta, lacrimal duct, and sac, and the nasolacrimal duct, okay, their purpose is to facilitate the tears of your patient, and then on the long run, it will also facilitate it will also aid on the protection of your eyes. Okay, so this is where your conjunctiva can be found. Okay, that's why your conjunctiva is referred to as a membrane that would line the eyelids. Okay, so it is a continuation from your eyelids. Okay, so it would connect to the surface of the eye, and then the connection to the surface of the eye is considered to be sealed. It will also ensure that there will be secretion of mucus. And the purpose of mucus secretion is to facilitate lubrication of the eye. Now, so still on the lacrimal apparatus, no, we'll just go back. So the lacrimal gland is intended to produce the fluid. Okay, the lacrimal canals are intended to drain the fluid. So you have your canal of Schlemm. Okay, you have the sac, the lacrimal sac. They are a passage of lacrimal fluid towards the nasal cavity. And then you have your duct that would empty the lacrimal fluid. Okay, so your lacrimal fluid from your nasolacrimal duct is intended to be a dilute salt solution. Okay, it is composed of salt. It would contain antibodies that would fight foreign substances, and it would even contain lysozyme to destroy your bacteria. It protects, moistens, and lubricates our eyes. So that's the purpose of your lacrimal fluid. Next, so here are the eye chambers. So there are two primary eye chambers. One is your anterior cavity, okay, and then you also have your posterior cavity. Okay, let's first talk about the anterior cavity. So the dividing point between your anterior cavity and then your posterior cavity, okay, would be your lens. So if you can see, okay, class, your anterior cavity is found in front of the lens. Okay, looking at the lens, if this is your lens, you can see that the anterior chamber is labeled here. Okay, so it is filled with the aqueous humor and it is produced by the ciliary body. So again, when I talk about anterior cavity, that would be in the front of your lens, and then it is filled with your aqueous humor. And your aqueous humor, class, is produced by your ciliary body. Okay, it is produced by your ciliary body. Now, what's the relevance of your aqueous humor? Other than being a fluid in the anterior chamber, your aqueous humor, class, would also be the one in charge of your IOP. Okay, meaning once there is an increase in the intraocular pressure, it would be, class, your aqueous humor that might be attributable to that. That might be attributed for that. Okay. Other than that, your aqueous humor is also intended to nourish the lens and the cornea and transmit the light rays. Now, other than the anterior cavity and then the posterior cavity, ladies and gents, your anterior cavity is also divided into two chambers. One is your anterior chamber, and then the second one is your posterior chamber. So what do I mean by that? So if I'll be talking about the posterior cavity, this will be the posterior cavity, since this is where the lens will be divided. Okay, so this is where the lens would divide the two parts of your eyes. Now, in your anterior cavity would have an anterior chamber which can be found between the cornea and your iris. It can be found between your cornea and your iris. Whereas the posterior chamber would be found between the iris and then the lens. Okay? Then, you have your posterior cavity. Your posterior cavity, class, is filled with vitreous humor. Okay, for that reason, it is also referred to as your vitreous cavity or your vitreous body. So when I talk about vitreous humor, this is a clear gel-like substance. Okay, and then it allows for the shape of the eyes. It keeps retina attached to the choroid, and it would transmit also your light rays. Okay, so again, this is your vitreous body or your vitreous humor. Okay, that's how big it could get. Our eyes is composed of 6 extrinsic muscles. Oftentimes, we refer to this as your EOMs or your extraocular muscles. So there are 4 rectus muscles and then there are 2 oblique muscles. So your rectus muscles, class, are in charge of your horizontal and your vertical eye movement, whereas, class, your 2 oblique muscles would be the one to rotate the eye in circular movements. Okay, so let's talk about your superior oblique. Now, your superior oblique would allow for the eyes to look out, meaning would allow your eye to move toward the temporal side. It also allows for downward movement. Okay, so this one is innervated by your trochlear nerve. Your superior rectus, on the other hand, would allow your eyes to look up. It would rotate your eyes upward and then towards your nose. This one is innervated or regulated by your oculomotor cranial nerve. Then you have your lateral rectus. Your lateral rectus would allow for your eyes to look outward. When I say outward, that will be again towards your temporal lobe. Okay, and this one is innervated by your abducens. Then you have your medial rectus. Your medial rectus would allow your eye to look inward toward the nose. Whereas your inferior rectus would allow your eye to look down, okay, which would rotate the eye downward and toward the nose. And your inferior oblique would allow your eyes to look in and look up. Okay, now the last 4 functions or the last 4 muscles that I have mentioned are usually regulated by your oculomotor, oculomotor cranial nerve. So if you would look at this, no, this is the diagram that would show what nerve is being innervates the specific muscle. So your superior oblique is innervated by your cranial nerve number 4, which is your trochlear nerve. Okay, your lateral rectus is cranial nerve number 6, that will be your abducens. And then you have the other muscles here, they are innervated by your oculomotor cranial nerve. So we have the cranial nerves. So these cranial nerves would have different function when it comes to your visual functioning. So cranial nerve number 2 would be in charge with optic functioning, meaning it is the one that allows us to see. Okay, it is the one that would transmit the sensory signal from the eyes going towards your brain. So if you can recall, your optic nerve is considered to be purely sensory. Then you have your oculomotor. If you can recall 3, 4, and 6, we usually say that the 3, 4, and 6 are the ones which are in charge of the eye movement. Okay, so 3, oculomotor, trochlear, and abducens. Now, we have an add-on of cranial nerve number 5 and cranial nerve number 7. So recall that your cranial nerve number 5 is O to touch. Okay, that will be your trochlear. That will be your trigeminal nerve. So recall that your trigeminal nerve has 3 branches. So you have the ophthalmic, maxillary, and mandibular. Now, the ophthalmic branch there will be the one in charge of the afferent part of your corneal and lacrimation reflex. Okay, so you have the afferent. Recall earlier on our early discussions on neurology that we have afferent nerves and then we also have your efferent nerves. So when I say afferent nerves, this would usually carry the signal, okay, from that organ where you are placing, for example, a certain medication going towards your brain, okay, or wherein there is a stimuli, I mean. Okay, so again, when I say afferent, that would be from your eyes going towards your brain. When I say, on the other hand, that it will be efferent, that will be from your brain going towards the organs which are triggered, okay, for the organs which are triggered. So again, your cranial nerve number 5 would be in charge of the afferent part of your corneal and lacrimation reflex. On the other hand, your cranial nerve number 7 is responsible for your eye closure and blinking, okay, usually by innervation of the muscle that we refer to as your orbicularis oculi. Added to that, it is in charge of the efferent part of your cornea and lacrimation reflex. So this time, it is your cranial nerve number 7, O to touch and feel. That will be your facial nerve, which is in charge of the efferent. Okay, efferent, meaning it's the one which relays the signal from the brain going towards the cornea and your lacrimation apparatus. So take note of these 6 cranial nerves which are in charge of your eye functioning. So there are 6. One which is purely sensorial, transmitting the signal. Okay, then you have your cranial 3, 4, and 6 which are in charge of eye movement. And then you also have your cranial number 5 and cranial nerve number 7. Now, this slide would explain to us how are the signals being transmitted from the eyes going towards our occipital lobe. So recall earlier in our discussions that the signals or the sensation of your eyes or the signal or the neurosignals from your eyes are being interpreted in the occipital lobe. Okay, so this diagram is actually lifted from your textbook. So take note of the legend that the red lines would indicate the right visual field, and then the blue lines would indicate the left visual field. Just for us to have a common understanding of what a visual field is. Okay, so for example, if this is your right eye, the part here on this side will be your right visual field, and then on this side will be your left visual field. On the other hand, for your left eye, this will be your left visual field, and this will be your right visual field. So both eyes would have left and right visual fields. Okay? Now, again, the red lines is your right visual field, and then the blue lines are your left visual field. Notice that if this image is seen on the left side, okay, or on the right side, or seen by the right eye, that is interpreted already on the left side of your brain. If this image is seen on the left eye, that image is interpreted already on the right side of your brain. Okay, now look at this differentiation, or look at what happens to the signals. The signals from this aspect, okay, would be sent to this part of the eye, and that would travel and be interpreted on the left side of your brain. Okay, so both the right visual fields are interpreted on the left side of your brain. Okay, again, both the right visual fields are interpreted on the left side of your brain. On the other hand, both of the left visual fields are interpreted on the right side of our brain. Now, let's look at the lesions. The first lesion here is a lesion from the signals from the right eye. Okay? So if there is a problem on the right optic nerve, there is a presence of lesion on the right optic nerve, this is what's going to happen. Your right eye will not be able to see anything because your right eye is unable to transmit whether to the left or to the right side of the brain. Whereas your left eye will be able to see, okay, both sides. Okay, it will be able to see both sides. So the red here again would signal the right visual field, and then the left here would signal your left visual field. So it's okay, both are functioning. On the other hand, if the problem is in the optic chiasm, okay, so remember, optic chiasm is the part where decussation occurs. When I say decussation, that is the crossing of our nerves, okay, or your cranial nerves. So if you would notice, if the problem is on the decussation, what would occur is that your left eye will be able to see the right visual field. Okay, try. Left eye, right visual field, it can go there. However, the right visual field of your right eye cannot be transmitted to the left part of the brain. Hence, it cannot be seen on the right eye. On the other hand, for your right eye, you'll be able to see. Okay, they will be able to see the left visual field. However, it could not also see. Okay, it can be able to see the left visual field. Okay, but it is unable to see, again, the right visual field. Okay? So I hope that you're understanding based on this diagram. And then if the lesion is on the right optic tract, na, for example, the right optic tract is here. Okay? So if it is the right optic tract, remember that it will be interpreting the left visual field. Okay? So the left visual field from both the left eye and the right eye cannot be seen by your patient. Whereas the right visual field from both the left eye and the right eye can be visualized by our patient. Okay, so try to pause the video and try to understand how come that if there's a lesion in 1, 2, or 3, okay, this would be the effects. Now, the different functions of your eyes. 1. Refraction. So refraction is taken care of by our lens. So refraction is, the purpose of the refraction of light is to focus the light to the retina. Then you have your pupillary constriction. So I have mentioned that pupil serves as an opening. It also allows for the focusing of the light. So your pupils, once the light is applied to your eyes, it will trigger cranial nerve number 2 that, oops, there's a light coming in. And then cranial nerve number 3 would contract your iris sphincter muscles, causing your pupillary constriction. Okay, which is the usual reaction that we would get if we are exposing our patient's eyes to light. And then you have your accommodation. Accommodation would be the change of focus from distant to near object. Again, this is done by your lens. And then your convergence. Convergence is the ability to turn two eyes inward toward each other to look for a close object. Okay, again, it would be the ability to turn two eyes inward toward each other to look for a close object. So accommodation and convergence are working hand in hand. So the next discussion will be focusing on the assessment of the eyes. Thank you for your attention.